to Good Morning Tobago on Tobago Updates, your source to current affairs in Tobago, Trinidad, and the region, with the perfect conversations to complement your morning routine. I am Kandace Jackson, and let's get started with the news in 90 seconds. Fire officers are feeling the heat in Tobago as they struggle to operate out of substandard facilities with inadequate equipment. President of the 2nd Division Fire Services Association, Leo Rampisoon, visited Tobago yesterday to get a first-hand look at the conditions under which officers operate. The Scarborough Fire Station is currently housed in the former Old Grange Police Station in Kandace, and a cramped space lacking the necessary facilities for efficient operations. Meanwhile, due to a shortage of fire tenders and equipment, officers are forced to use their own personal vehicles and whatever equipment they can muster to serve the public in times of need. Meanwhile, Condor Airlines is expected to resume direct flights from Germany in the winter of 2023. The Tobago Tourism Agency Limited announced that Condor will be operating a weekly flight on Tuesdays between the Frankfurt Airport and the A&R Robinson International Airport, commencing on November 7, 2023 until April 9, 2024. All flights will be on board the new Airbus 330-900 and will be available for booking from May 1st, 2023. The executive director of TTAL, Alicia Edwards, stated that a resumption of this flight indicated that there's still confidence in Destination Tobago. And in some news of crime, the Tobago Assistant Commissioner of Police, Collis Hazel, gave the murderer of Nathaniel Thomas 48 hours to surrender to the police. Thomas was shot multiple times yesterday at his Signal Hill home. ACP Hazel said life would not be easy for the perpetrator if he did not turn himself in. According to the ACP, the incident was deeply troubling and called on Tobagonians to come forward with any information related to the incident. And that was your news in 90 seconds. A whole lot going on right now in Tobago, and of course the police, or ACP Hazel, giving that very strong call, to the person responsible for the murder of Mr. Daniel Vincent to come forward. So otherwise the police is going to come down on him. So we look forward to seeing what energy that ACP Hazel is going to bring to the Tobago Police Force. And we are certainly supporting whatever effort he is making in making sure that, crime is kept to the absolute minimum levels here on the island, and we can return to that level of safety and security. So, yes. Now, turning to our discussions this morning, we are going to be speaking with Dr. Nathaniel Duke, who is the Chief Medical Officer of the hospital at the Roxborough Hospital. Good morning and welcome to you, sir. How are you doing?
I'm doing fine. Good morning, everyone. Good morning, Tobago. It's an honor to be back again.
Great. And so, we've got some fun things, some wonderful things happening at the Roxborough Hospital, especially when it comes to cataract surgeries. We recently got some new equipment.
Yes. So, the facility by itself was the recipient of some new equipment specifically for cataract surgery. So we will be reminded that September, October 2022, the Secretary of Health gave the TRHA a mandate to clear the backlog of cataract surgeries. And that mandate was specifically filtered to Roxborough, where we were asked to actually undertake that mandate. So what happened, we did a massive call to action where we had a calling center and a coordinating center which was established. And from that, we received over 1,000 patients calling in and asking for the service to be provided. It was a very, very dynamic logistical process for Team Roxborough because it was a young team, and we had to embark in training of staff even before the service began. So the service line was subsequently divided into, you had the screening phase, the surgical phase, and the post-operative phase. And doing all of this in a pandemic where we had to make sure that everyone was COVID negative, and the team really had to rally around each other. And we were operating some very long hours. So we had under collaboration with the overseas ophthalmologists. They were coming out of Toronto, Canada, and some local ophthalmologists as well. And doing so, we were able to approximately do 30 cases per day. All right, so we were working from 7 in the morning to sometimes 11 at night. And at about 30 cases per day, so we were able to complete 580 cataract surgeries at Roxborough within a 3 months' time. Of that, when that exercise was finished and we dissected the data, we recognized that some individuals will require surgeries on their other eyes. So we are now in the phase where we are embarking upon second eye surgeries, as well as any other backlog that exists within the system, trying to clear it out. So the Executive Council has given the approval for 700 more surgeries to be done. And these new equipments that we have received are what we call the Rolls-Royce equipments of cataract surgery, of ophthalmology. So we were able to partner with Very Medical in getting the equipments to Tobago. They are here. And the good thing about these equipments is that one can have a training component. They are built to train. So you can have physicians who want to learn these techniques be trained on these equipments as well, with oversight from the experts. Yes.
So now, could you explain a little bit about, this new equipment and what is it about it that makes the surgery, to cataract surgeries, easier for the doctors to perform?
Right. So the new way of doing cataract surgery is called phacoemulsification. And what that basically means is ultrasound, high intensity ultrasound is via probes. It's inserted into the eye and it more or less breaks up the cataract. The cataract is that thick layer over the lens, which is formed for many reasons, many medical reasons, and causes the lens to be dense and light will not be able to pass through your lens. So what happens is with phacoemulsification surgery, the phaco machine, that's what it's called, when the ophthalmologist inserts a probe into the anterior segment or the front of the eye, that actually emulsifies or breaks up the cataract. And then it is just extracted by suction. All right. There's a lot of, because you are dealing with very small microscopic spaces, there's a lot of, you can have a lot of error. So there's a lot of calculation that have to be done. It's a very fine technique that has to be refined. People go under extensive training for this. And also, there's some margin of error that one has to cater for. So these new equipments, they take into all of that into consideration, the margin of error, the calculations. And these equipments will be able to do all of that background work, even while the surgeon is operating. So he no longer have to think about all of these things. Yes, you are looking at the pressures and the numbers that the instrument is giving you as a guide, but it has become a fully semi-automated process where the surgeon is now doing the procedure and the equipment is doing all of the calculations and putting all of the stop gaps in place and actually warning the surgeon, hey, we might have a problem, don't go forward. And the equipment will take into consideration the intensity of the ultrasound wave that is to be delivered to the eye based on the thickness of the cataract. So the surgeon no longer has to work hard to get that cataract off. All of that is done by the equipment, and he just have to make sure that he guides the probe appropriately. Also, with the microscope that we have acquired, this is one of the best microscopes that eye surgeons can use, produced by Olympus. So the optics in this microscope provides for high definition. So the surgeon will be able to see structures, and the clarity by which he'll be able to see the eye during the surgery is far, far greater than of all of the equipments that we have. So we have new precision equipments. We have equipment that take into consideration some level of artificial intelligence. We have equipment that will be able to do all of the background calculations and have all of the safeguards, top measures built in it, as well as we have the optical microscope, which is high definition, so that the surgeon will be able to, he knows where he's going and when he's going. And the good thing about this level of optics, we can, the image can be sent in real time anywhere in the world. So you can have another surgeon from anywhere in the world
to consult.
Yes. And also you can have a trainee surgeon on the other end of the microscope looking in and seeing how the procedure is done. So not much places throughout the Caribbean have this form of technology.
So in other words, we can open up our services for our Caribbean neighbors.
Well, during the presentation, the advisor to the Secretary for Health, he announced what he coined the Roxborough Eye Institute. And that is something that we have been thinking about. We have looked at how we can market what we are doing, not only for Tobago, not only for Trinidad and Tobago, but for the Caribbean. What I recently learned that it is very difficult to get top quality cataract surgery throughout the Caribbean. I recently learned about that. So with this form of technology, what we are saying is that we can have, we'll be delivering the service. But if we can aim for a higher level of existence, where you can now have a training component built in, as well as offer this the service for a fee to our Caribbean brothers and sisters. All right. So I think that we are onto something good in Roxborough, where once everything goes well, we can see that the Roxborough Eye Department or Department of Ophthalmology emerge and rebrand itself as an institute of higher learning as well. The good thing about having Professor Pons and his team out of Canada, that they are coming with a certain level of accreditation. And we're talking about Canadian and European accreditation. So we have that backings, and this is what they do on a regular basis. They do a lot of training all over the world. So we are trying to tap into this resource where we'll be able to, one, bring this level of expertise to the island, two, provide training for local physicians as well. Because if you are a local physician, Trinidad and Tobago, and you're an ophthalmologist, and you need more experience in cataract surgery, where do you go? You have to fly to the US, the UK, or Canada, and hope to get into one of their training programs. So this is where we are saying, you know what? With everything that we have, we can provide this level of training for the country, all right? Instead of you paying how much $1,000 US when you fly overseas to get this, we can give you the necessary training and provide you with the numbers too. Because I think you need to do 100 independent before you are signed off.
Yes.
So we have the numbers in Tobago. We have the numbers in country as well.
Approximately how many people in Tobago are affected by cataract?
One of the things about cataract is that it's a disease of as you age, most people will develop some form of cataract. And just because of our geographic location or excess ultraviolet light, then you have underlying comorbidities, diabetes, etc. They all result in the accelerated formation of cataract. I can tell you that when we did the numbers that were registered within the TRHA, we were looking at close to 500 in a backlog. All right. And then when we opened up the call to action, we got over 1,400 calls.
Wow.
Right, for this level of service. So there is a huge burden of cataract in Tobago. And if one was to do ophthalmic screening on the whole island, you would find even more. Right? So as the population ages, as chronic diseases become more prevalent, cataract will continue to be an issue. Yes.
So if people are out there and they are not yet in a system for cataract or just eye care, what can they do to be able to, have themselves in a position to access these services?
Right. So the TRHA offers full eye screening. We have an ophthalmic department at Signal Hill. And once they identify that's having a cataract of any sort, the ophthalmologist will then refer them on for cataract surgery. Or if you see your optician and your optician tells you, hey, you have cataract, you can also present yourself to have this level of evaluation be done. Not everyone who have cataract will need surgery immediately. Sometimes the cataract is just too small for surgical intervention. All right. So the patients are advised as to when it will be appropriate for surgical intervention and what they can do to slow the progression of the cataract. Right? So, I mean, ultimately, you really don't want to have people undergoing surgical intervention. That's a wish, but most of these patients eventually end up having cataract surgery and lens replacement. That's the other issue, cataract surgery and lens replacement. And in so screening of these patients, we are realizing the high incidence of glaucoma among patients who are coming for cataract. So we are looking at both cataract surgery and glaucoma intervention. And a lot of these patients require glaucoma surgery as well. So the equipments that we have are also capable of performing the glaucoma surgery. So the whole thinking behind the Roxborough Eye Institute, will be to provide what we call anterior segment surgery. So the eye is divided into the anterior segment and the posterior segment. And the anterior segment is what is being affected by cataract and glaucoma, really. So that is where we can do that necessary intervention. Well, you see,
So is there any other place in the country that offers all of these eye care services together in the public health system?
There are bits and pieces throughout the other RHA. I mean, all the RHAs have ophthalmic care. The volume of cataract surgeries that are being done within the public system nationally is low. That's why you have so many people going to the private sector.
Yes.
Right, at an astronomical cost to individuals. This amount of surgeries, 580 surgeries in less than 3 months, have not been done in any other RHA before. Right? So Tobago is definitely a champion with respect to how you can do approximately 30 surgeries per day. Right? So Roxborough have shown that it is not impossible, it is possible. Once you have a dedicated. The team and the nurses were absolutely amazing, and the ward attendants, you must give praise to them, where they would start at 7 in the morning, and as they progressed throughout, they became more efficient. And they would call me and say, Dr. Duke, 5:30, we are finished. And I would be like, how many cases you all ran off today? 28, 29. And they're finished by 5:30. Before, they would go up to 11. But then they became so efficient at it that by 5:30 they will close it down.
Wow.
Right? So we have a momentum among this the department, and we like to keep the momentum going.
Right.
Yeah.
So, I mean, we're seeing that development of ophthalmology care happening at Roxborough. And, I mean, that's definitely one of the things that you guys are considering, like expanding that and
Yes.
maybe being the first in the country and for the Caribbean as well. But we also saw earlier that, there was some advancements made in terms of the hyperbaric chamber and the services that offer. What are the updates? Are there any updates on how those services are coming along, especially when it comes to, just the blood circulation aspect of care and that kind of thing?
Well, hyperbaric oxygen therapy has been along for a long time. Since in World War II, the U.S. Navy was using it extensively. And now it's adapted for medical use as well. In Tobago, we have the only hyperbaric chamber in the public healthcare system in Trinidad and Tobago. So we receive patients from throughout Trinidad and Tobago and the Caribbean. All right. patients flying from Barbados, etc. We even got patients all the way from Switzerland asking for our services. So the hyperbaric chamber is approximately 22 years old, that piece of equipment, and it is still functional. So it says something positive about the team and maintaining that piece of equipment. What we have recognized is, besides the treatment of the bends and the treatment of wounds, the hyperbaric oxygen therapy is indicated for approximately 14 medical illnesses.
Yes.
Right? Radiation burns, plastic surgery, flaps, skin flap not healing well, and even for athletes, these high-intensity athletes, they will put them in the hyperbaric chamber for appropriate recovery, for faster recovery as well. So in terms of where the advances that are being made in the hyperbaric at Roxborough, we have what's called a monoplace chamber. And a monoplace chamber, this basically means you can only put one patient at a time. Due to the patient volume that we're receiving, and individuals are asking to access the chamber more and more, locally and regionally, we recognize that the monoplace chamber is no longer sufficient for the needs of the service. So we are looking at the purchasing of a multi-place chamber, which is a walk-in chamber. The chamber that we have now, we have to basically lift you in,
Yes.
or you have to be ambulatory. You must be able to have the upper body strength to go in. So it's a challenge for the elderly, especially.
And of course, it's a service that the elderly needs to be able to access.
All right. So we have looked at the purchasing of a walk-in chamber, which can accommodate 8 patients at a time.
Now, would this be one of the first in the Caribbean, or?
It will be the only one in the Caribbean and Latin America.
Wow.
All right. We have teamed up, well, during the exploratory phase, and this was supported highly by the Division of Health. And may I say that this is a project which is going to be led by the Division of Health. The secretary was very enthusiastic, and the secretary really put the power of her office behind it. And I would like to thank Miss Dr. Faith B. Israel for really championing this, and the Executive Council, because they gave the approval. Executive Council gave the approval for this project to go ahead. And coincidentally, yesterday we were in a technical meeting where we were thinking now how to pull the technical aspects together. A supplier has already been engaged for the chamber out of the United States. And this supplier is coming with the power of the World Hyperbaric Association.
Wow.
All right. So we have Dr. Tyler Saxon. He's the president. And he has been the one who will be giving the technical input with respect to the chamber logistics from the US to here. There's a lot of players involved in this, because we're talking about bringing something which deals with a lot of pressures and forces, and it has to be certified by the US Navy. So all of that has to come into place. And then when this chamber arrives, we have to be ready logistically on the ground to receive it. There's a lot of civil and mechanical engineering. So the Tobago House of Assembly and the Division of Health has engaged EIDCOT to be the project managers to look at this. We also have to look at China Railway, since they were the ones who designed the facility. How would that now tap into the current oxygen generating system of the hospital? So there's a lot of technical work that has to take place. But the good thing is that it's going to happen.
Yes.
And with this multi-place chamber, we'll be able to provide care for more patients, one, and it's coming with a teaching component. When we decided to train and certify our staff members in hyperbaric oxygen intervention, we had to engage people from Texas as a tremendous course to come down and provide a certification. So we have trained and certified hyperbaric technicians, trained and certified hyperbaric nurses, all right, and trained and certified hyperbaric physicians in Tobago. We also were able to have DAN, Divers Association Network accreditation. So Tobago is listed as part of the hyperbaric facilities network across the world. So divers now, when they want to dive, they will go to the DAN site and they'll say, oh, Tobago has a chamber, so I'm more comforted if I go there and dive. We are also looking at, we have the accreditation of the Undersea World, all right, Hyperbaric Oxygen or Hyperbaric Medicine Association as well. And the US Navy paid us a visit because when they are doing their special ops, they want to make sure that a chamber is available. So they paid us a visit and they were quite satisfied with what they have seen. So now we want to look at it from a different level. We want to have a more advanced chamber, a larger chamber that will be able to provide service to more patients, and also will be able to provide where you will be comforted, because now you can have the medical staff in the chamber with you. Because this current chamber that we have, if you undergo a medical emergency while you're in the chamber, it will take us 3 minutes to get the medical staff in, because we have to now put the staff in a lock, close the lock, pressurize, equalize the pressure, then get into you. All right? With this chamber, the medical staff can go in, you are seated on a chair, and everyone will be there. So your medical intervention will be much more rapid. All right? So that's the direction in which we are going. And also, we want to offer a training component because we have so many certified people. If one wishes to become certified in hyperbaric, one has to fly again, the US, UK, or Canada. So now we want to be able to have a teaching module to deliver this level of training here, because we have all the certified people in Tobago that can deliver this level of expert training to anyone.
All right.
At a fee.
Now, we've got a lot more to get into when it comes to the Roxborough Hospital with Dr. Duke here, because, of course, you've seen, well, you've heard, I should say, you heard, all has been happening so far, and it's just in just 2 areas. So we're going to see, we're going to hear a bit more about what's happening in Roxborough when we come back after this break.
As the passion start to rise, the energy fill the sky. Yeah. Hey. Tobago updates.
Welcome back to Good Morning Tobago on Tobago Updates. Well, viewers, we are continuing our discussions with Dr. Nathaniel due to the developments of the Roxborough Hospital. Some good things are happening when it comes to cataract services and surgeries, as well as, developments where they're looking to increase the services offered in terms of hyperbaric services and that sort of thing. Now, the Roxborough Hospital, Roxborough is supposed to be a hospital offering 24-hour services. However, there has been some challenges in getting to that point. So, Dr. Duke, what can you tell us about, where we are right now on the pathway to becoming a 24-hour hospital?
Okay, so the reality on the ground is that when January the 6th or the 4th, when I assumed the position of medical chief of staff at the facility, I rapidly recognized that there were a lot of infrastructural work that had to be done before the clinical areas can be occupied. And one had to pull together the full technical team to be able to execute a lot of these work. It has been a year, and more. All right, and all of the technical work has been completed, and the inpatient um, areas have been outfitted and are ready to receive patients. What is the keepback? It is strictly a question of human resource now. We are still awaiting the human resource process to activate the clinical services. So there's a new board which is on, and the new board is mandated to make this happen. As medical chief of staff, what I've been advocating for and trying to champion for the people of Tobago is, since we have activated the emergency room services on September the 9th, and we are operating from 7 a.m. to 7 p.m., we have seen a rapid increase in the numbers of patients coming into the emergency room with all sorts of illnesses. And as the year turned around, 2023, the volume has quadrupled. So we have moved from January 2022, where you were seeing like 200 to 300 patients in the emergency room. Now we are seeing over 800 per month in the emergency room at Roxborough. And this is operating at from 7 a.m. to 7 p.m.
Oh, well, we haven't had any complaints so far, so it seems as though the services are being delivered at a high enough standard.
We do try our best to ensure that the staff morale is kept high. We do try our best to ensure that the junior physicians are always around a senior physician. And because of, I've had to be very innovative in designing this model. One of the things that I've impressed to the staff is that patient care is at Roxborough will be senior driven. All right. I was a junior once, and I understand what it means to be a junior. And as you ascend up in your medical knowledge and what we call the totem pole, as you go up, it is your responsibility to ensure that all of the patients are given senior level oversight. And I always ensure that the seniors are on the ground. So when you go to Roxborough, you will always see someone senior in the emergency room. So it's not only the emergency room, which is the face, because we spend a lot of time ensuring that the face of the institution is always pleasant. You have, from the time you get in, you are greeted by someone. Even if it's a cleaner, it's a water tech, someone greets you and shows you where to go. We have ensured that outside in the waiting area, there's always a physician there in a room. So for those who are coming just for prescription refill or something fast, that you do not have to wait hours for that. And those who require higher level care, they go inside.
Yes.
All right. When you go inside, you will see a lot of staff, but there are always two seniors there. The recruitment process did not afford us to have the specialists that we needed. So I've had the pediatrician, I have the pediatricians seeing all the kids. So the children who come to the emergency room in Roxborough are seen by pediatric specialists. The females with gynecological or obstetric issues are seen by this specialist obstetrician. And all the other patients are seen by the internist, all right? And if you need surgical intervention, you will then be transferred over to Signal Hill. Our outpatient specialist services were started where we have dialysis,
yes,
we have nephrology, we have medicine outpatient, we have pediatric outpatient, and we have obstetrics and gynecology outpatient. We have seen, because of the numbers, there is a need for urology. A lot of men are coming to Roxborough from the east with a lot of prostate problems. So I have made a special a request to the board for a urologist to be employed for the Tobago East. The medical imaging department, X-ray, ultrasound, CAT scans, all right? And we are doing our best to ensure, to now make sure that a CT radiographer, a CAT scan radiographer, is stationed at Roxborough every day. And we have one of the most advanced CAT scans in the country, 64 slice. We can do a lot of work with that. It is underutilized. And just yesterday, the board members which are overseeing this granted the appropriate approval. So we're going to see CT services, CAT scan services at Roxborough being more predominant. But one of the challenges that we are facing clinically, from the clinical point of view, nursing and physician, is the recruitment process. And we do not have oversight over the recruitment process. The recruitment process has been very tight with respect to the facility. And it has been something that has been haunting myself as well as the nursing management of Roxborough to ensure that we get the people on board. Because you can't do a 24-hour service with a skeleton staff. All right? It is not safe. We have started minor gynecologic procedures at Roxborough because we have a very advanced operating theater. So we decided to use it. But it's only now being used just for minor gynecologic surgeries because we were seeing so many women who needed help.
Yes.
All right. So we decided that we are going to intervene and help these women. All right. But our major challenge is the recruitment process. The recruitment process somehow is a little bit too slow. And it's a year plus into this.
And who is responsible for that recruitment process?
Well, ultimately, the recruitment of any officer or any staff within the organization is that of the Human Resource Department and the Office of the CEO. And now you have a board, and the board has what's called the Human Resource Committee, which provides oversight over all of this, right? So the board has recently came on. They are getting their foot wet. They are understanding the processes. And I'm sure that this board, which is very dynamic, and they are actually taking a charge that they are beginning to correlate the information to push the recruitment process. All right. The facility as well had some design challenges, and you have to accept that. You have to accept that. Hey, this is what it is, and you have to work with what you have, because what is your goal ultimately? I think that sometimes we get ourselves tied up in bureaucracy and all of these. People try to throw all sorts of policies that they read on the table. But you have to, what is the reason for you being here? And that is to provide a service to the people. If in your capacity, all right, you are putting up obstacles for such, that is not right, especially to the people of Tobago East. So one has to go back to our core. What is your core function as a healthcare provider or a healthcare administrative individual? Your core function is to provide, all right, the best optimal clinical service to those in which you are charged to take care of. All right, that is what you're there for. And that has been my drive all the time, and that has been my focus. All right. So yes, there are infrastructural challenges, there are those challenges with space, etc. But looking outside of that, if you continue to look at it like then you'll be putting yourself in a box mentally where you will get nothing done. You have to look outside of that and look at what is your wider objective. Right? Your objective is to provide care for these people. And that is what we are here for. So I will continue to push along, and I will continue to advocate that, one, the recruitment process be advanced to the point where we'll be able to soon announce the opening, and it is recruitment of clinicians and nurses, right? And also it is the infrastructural issues can be taken care of because we have engineers, we have all these bright people.
Yes.
So we don't really have to be reinventing the wheel, right? We just have to understand what is our core directive and execute it. Yep.
And so when you encounter these problems, you know, what do they tell you?
The excuses that are given, I basically say these are not excuses. Because how I was trained, you do not come to your boss. I was trained in the US. You cannot go to a meeting with the hospital trust with a bunch of excuses in your basket. That is not something you can do as a senior physician. You have to come to the table with how are you going to execute this directive. And I have seen quite a bit of my colleagues have been told by some of my mentors that thank you for your input, but it seems like you don't want to be a member of this team anymore. And that is one thing I loved about the United States, because they will have a very nice way of telling you goodbye. Right? We have to come out of this zone where it cannot be done. And there's no explanation why it cannot be done.
Because at the end of the day, it is people on the ground, Tobagonians, your own family, your own friends, that are ultimately affected.
Yes. And I always say, you know, for me, I was born in the Tobago East, and my parents migrated to the West. So I'm a Goodwood man, all right? The people of the East have been asking for a hospital for more than half a century.
Yes, they have.
All right? And now we are in a position where we have to deliver this to them. It's not if and or but. We have to deliver this service to the people of Tobago East, where I will not accept any excuse why it cannot be done, right? And as a member of executive management, I will be the first to say that it has to be done. And let us, you know, all the other technical stuff, one can work around it. That's why we have bright minds. You can work around it. But you have to give care to those you are mandated to give care to, all right? That's what we are there for. So I await the HR process, and once the HR process has been completed, then myself and Team Roxborough, I always call them Team Roxborough, we are going to rapidly accelerate.
And we're already seeing that Roxborough is becoming this premier place for healthcare in Tobago. And of course, this is, I mean, a large part to do with your leadership in making it all come together. Now, we spoke earlier also about the cataract services and the hyperbaric chamber and the developments that are to come there. What other specialized services are you envisioning for the Roxborough Hospital?
Sometimes I don't want to toot my horn, but if you want to be futuristic in your thinking, you see, you have, in a small hospital, you have to be very creative.
Yes.
Because small hospitals, and this is one of the things, small hospitals have the highest efficiencies. Large hospitals don't. And this is something I learned when I lived in Florida and interacted with multiple administrators. And it was very fascinating to see one of the most profitable hospitals in terms of efficiency was a 50-bed hospital that was based in Hialeah. And I was absolutely amazed at this. So small hospitals have a different level of operations. And so what I would like to see at Roxborough, one, a fully implemented electronic medical record system. where you will come to the facility and your records will no longer be stored in a cabinet in the back.
And it would be the first for the country.
I would like to see a fully implemented electronic medical record system, which would be a game changer. That's one. Two, in terms of service delivery, one will have to look at other services. A typical example, I've already alluded to urology, right? But I was talking to my team, and I asked that same question: what service Tobago needs? And the pediatrician looked at me and said, Dr. Duke, there's a desperate need for pediatric cardiology on this island. And when we started to drill down, and you recognize that every child who has a cardiac issue have to be sent to Trinidad for diagnosis and follow-up, and the parents have to go with them. So they arrive on the airport or in Port of Spain on the boat, make their way to Moncton, and then after that, sometimes they have to overnight and then return back, and then they have to go again for follow-up. So we looked at why not bring the pediatric cardiologist to Tobago. And we had a conversation with the pediatric cardiologist, and he said, great idea, I'm all for it. This will save Tobago a lot of money, but you can't quantify the time of the parents.
Yes.
All right, and the disadvantage of the parents. You can't quantify that. So in the initial phases of discussion, where Tobago can have a pediatric cardiology service, right? That's one. So that's futuristic. The Roxborough Eye Institute as well, if once that pulls off, that would be very futuristic for Tobago. And also, in our inpatient services, especially on the surgical side, there's a Tobagonian who has been advocating to give service to Tobago, especially in the field of minimal invasive surgery. So we do have an operating theater that can accommodate that. So he's a...
That's like laparoscopic
yes.
surgery and so on.
So laparoscopic surgery.
Laparoscopic, yes.
As well as other minimal invasive surgery. And we are in preliminary discussion because he's very keen and eager to provide this service. Also endoscopic gastroenterology services. Since we have the surgical team, which is to be recruited, but one of the things that we want to ensure is that we have endoscopes for both adults, and this is a kicker here, children.
Children.
All right, because the pediatric endoscopy isn't really done. All right, so but Tobago has a pediatric gastroenterologist whose skills are underutilized. So one of the negotiating platforms that I'm going to use in the acquisition of the endoscopes is to try and convince the supplier to give us one or two of the pediatric endoscopes as part of the deal. And it's just a matter of how you can negotiate. And once you can get these things on the ground, then you can bill out these services. And this is going to really help in the decreasing the transfer burden from Tobago to Trinidad. So these are the futuristic things that we are looking forward to. But right now, our main goal is to activate the inpatient services.
Yes.
And then from that, you can build out all the other supplemental services around it. Mm. Yes.
Yeah. And then what's it been like, just getting the team together and making sure that, there is that synergy within the staff at the hospital?
That was the easy part. People were very enthusiastic to come and work at Roxborough. That to me was the easy part, because these were individuals they asked to transfer to Roxborough. So I was like, okay, no problem. And when they came, they really did a fantastic job. I mean, humans are humans, but one of the things that I realized is that quite a bit of the staff are from the Tobagoese. So what I told them is I said, if you treat your people bad, then when you go home back to your village, they're going to cuss you. They're going to cuss you, all right? So that's where we are seeing the whole tanty, grandma, come, I'll help you, we're not going to refuse anybody. People hugging on the corridor, people giving each other a high five. They're always smiling because there's that connection, all right? And so that's one of the major unique things that is taking place up there, and I encourage it, all right? If someone comes and they don't have an appointment, I'll say, slot them in, we'll see them. I'm not really going to reject you. Even if it's just to have a conversation, we'll have that conversation with you. All right.
And then how important is that sort of an approach in terms of delivering a high level of care to our citizens?
Well, you have to be patient-centered, all right? And in Tobago, we have to understand the word of what it means to be Tobago-centric, all right? Because you have to be patient-centered and Tobago-centric to treat with your own people, because no one is going to come here and treat them good for you. You have to treat them good. So my philosophy and the philosophy of the nursing management team at Roxborough is that we go beyond the call of duty for your patients. Sometimes you feel like if there's no gratitude, all right, but when we all took our oath, all right, the oath never said that you're going to be given gratitude. All right, the oath said, your oath indicated that you are the voice of the voiceless. And that is what we continue to advocate as much as we can. All right, so, and then provide that level of mentorship to the younger ones coming up.
Certainly. I mean, and it's such, good news that we hear it coming out of the Roxborough Hospital despite the challenges, because I don't think that people really understand, what were the challenges that were faced when you took up the position to lead the staff at the hospital and to make sure that, you can fulfill the mandate that hospital was supposed to provide. It was not easy.
And it wasn't easy to try to convince individuals who are not from the Tobago East. They don't understand some of the issues that the people of Tobago East face. Because one thing I always say, try taking an ambulance from Charlottesville to Signal Hill. I'm riding in the back of that ambulance as a sick person, all right? During jazz, we open up the emergency room. In fact, every time we open up the emergency room on weekends, we are inundated with patients. So during jazz, the emergency room was opened up. And from 5 p.m. till 1:30, it was constant jammings in Roxborough. And there was a patient who came in unresponsive, and the family member said, possible seizures, they don't know. And she had vomit all over. And she came from one of the nearby villages. And I would tell you, if that ambulance was to take that patient to Signal Hill, she would not have made it. All right, stopping into Roxborough, and we were able to stabilize her, clear her airway, all right, and give her the care that she needed to be able so that she can be transferred to Signal Hill for further care. If that ambulance had to go direct, the conversation would have been different. All right. So that is the level of intervention that we are there to provide, and that we should be supported 100% in the execution of this mandate. This is not our mandate. This is the mandate of the Tobago House of Assembly, who are mandated by the people of the Tobago East to provide this service. So we are just the executioners of the will of the people.
All right. I think that's a perfect way to leave out the update that we're having here about the Roxborough Hospital. Thank you so much, Dr. Duke, for all that you're doing. Thank you for being here and for being able to share all the developments that are happening.
You're welcome. Thank you.
All right, viewers, and that's how we're going to leave it this morning. So please have a safe and wonderful weekend, and we'll see you again on Monday.
I say thanks for favor to wake up and hear me neighbor. 60,000 people strong.